Hi ladies, and welcome back to my channel. My name is Janelle, and this is not only a trying to conceive journey channel, this is also now a pregnancy journey for me. This is pregnancy number 8. I have miscarried 7, and you have been on almost every journey and miscarriage I have been on. As you would have noticed, I uploaded the other day, and that was my 8 and 9 DPO. So if you haven't seen that video, please go check it out before you continue to watch this one. I do want to apologize though, that 9 DPO video, I had lipstick on my teeth. I did put it in there at one point, had a couple of nasty comments which wasn't necessary. I am just a normal person, yeah. It happened, and I am sorry, and it probably did take the focus off my actual video, but I do apologize. And I've decided that I'm not going to upload all the videos that I have taken over the time. I've decided just to do this video and then just add heaps of clips in there. So this may be a long video. I'm not sure where I'm going with it. I'm winging every little bit. So currently, today is the 9th of January, I think, 2020, and I am currently 14 weeks and 4 days pregnant. And yes, everything is going beautifully, so I will start from the beginning and work my way through. And I do apologize that I have not updated you with the emotional journey that we have been on. I wanted to show you a happy video and a happy, ending. I didn't want to, I was hoping that we weren't going to go through number 8 and then, I'm showing you all these great videos and then it ends in disaster. So I think I've shown you enough of them. So I waited until I was safe and everything was great. And I just decided not to upload all my videos. I will upload little clips, but I just won't upload them individually. I just want to get you up to date as soon as possible so that I can upload future videos on time with you as well. Okay, so let's go back to when I found out I was pregnant. So found out I was pregnant, you've seen the video, and I'm going to put in here in one of my next clips as well, my progression video on all the pregnancy tests I took within that sort of 8 to 12 DPO and possibly further on. I think I have some progression videos even to go from 1 to 2 weeks plus on my Clear Blue, 2 to 3 and 3+ weeks. Okay, so this is my 8 days past ovulation to 13 days past ovulation. I'll do close-ups for you. So of course, 8 days past ovulation, I had done a test and thought it was negative, and then later on I'd seen this line and I thought, is it an indent, is it not? And continued on with my day, which I climbed the pyramid here in North Queensland, which was like 1,000-meter elevation. So I was gone 5 hours of that hike. And then 9 days passed, which is the next one. That was about 5:30 in the morning, and the line was a whopper straight up. I couldn't believe how dark the line was. I was very hopeful. And then at the same time, I got 1 to 2 weeks on a Clear Blue at 5:30 in the morning. I could not believe that how early I got that 1 to 2 weeks. The next one is 10 days past ovulation, getting darker, and then bam, the next day 11 days past, and I got so excited about those lines. Never had them that dark before. And then 12 days passed, it was darker than the control line, and I could not believe it. I compared it to the other test and decided I'm going to get out of Clear Blue. I know it sounds absolutely crazy that it would come up 2 to 3 weeks, but I thought, let's give it a go. And would you believe 2 to 3 weeks came up, and I knew at that point my levels at 12 DPO were definitely over 100, and I could have just bawled my eyes out that day, knowing how good they were and thinking maybe the 2 follicles I have taken both of them. I also had a blood test that day, and to my shock, the blood test came back at 132 12 days past ovulation, and my progesterone was 191. So I will be putting a clip in, and that is of the nurse telling me this, and a possibility that both follicles have fertilized and I may have 2 babies in there. So the next one is 13 days past ovulation, and the lines, they don't look too much difference if it focuses, but however, when I did watch the test as it went, the line was darker than the control line really quickly, as it did take longer at 12 days past. So I definitely know it's still progressing and everything's perfect. And actually I haven't taken out the end of there. So if I haven't said it before, if you take out the end here just with some tissue, you can just pull it out. It preserves them a little bit longer so you don't get all that yellow disgusting look inside. The only thing it does, it dries them out though and makes them look a bit lighter, but that's it. Okay, so ones I didn't like, these are the cheapy ones. Now that one was 9 days past, and it's very hard because the window's awful, so I won't spend too long on there, but it's 9, 10, 11, 12 and 13. That 12 one just here, it barely showed, so I actually don't like them. Yeah, they're only just cheap. And this one here is 12 and 13 days past for clear blue. My ovulation test on 13 days past was crazy, as you can see. That's just normal Wanfo, only got 2 days worth of that one. And these cheapy ones go from 9, 10, 11, 12 and 13. So I don't really like the cheapy ones. They don't give a good indication, and it probably is because they don't have a sensitivity like the clear blue. However, these pink ones apparently are supposed to claim they have 10, a sensitivity of 10, which is strange because those lines do not look dark at all. So yeah, I will insert a picture, of course, because I know you'd want to have a close-up look without me moving the camera, and you can compare for yourself. Of course, if I am having 2, this will be no comparison for a single, but crossing our fingers that we just have 1 healthy baby at least. So yeah. So I did take a lot of pregnancy tests, and if you had as many miscarriages as I had, you would totally understand why you would take these and look at the progression and see how it's looking. And from the very start, it looked amazing. The pregnancy symptoms weren't really there. They were, but nothing extravagant, which worried me a tiny bit. But not everyone gets strong pregnancy symptoms. So I would have, I don't have my phone with me, but because I'm only winging this, but it would have been hot flushes, a little bit of breast tingling maybe, and there is TMI in here, so if this is not your type of video, please click out now. Yeah, I didn't have an extreme amount of symptoms. I think as I went further, so as I said, I did the progression videos and I will upload the other ones as well. I got my 3+ weeks, I think, at 21 or 22 days past ovulation, and I think my other ones were like 28 days past, so I knew things were going pretty good then. I will add a clip in here shortly of my 12 days past first Hcg test.
Alex, how are you going?
Yeah, good, thank you. I was like, I just missed your call. You know how you stalk the phone waiting for you?
Oh, I know, no, I do the same thing. If I don't really recognise the number, I'm just like, oh, if they really need me, they'll leave a voicemail.
Yeah, yeah.
Okay, so I just want to let you know that the bloods that we got you to do have come back and everything's looking really good. So your Hcg is 132, which is a really good range considering you're not even the 4-week mark yet.
Ah, I'm only like 12 days past today. That's ridiculous.
Exactly.
I was only like,
amazing.
I think I was 16 at 11 days past last time.
Yeah. So that's a really good indicator. So,
132?
Yeah.
Holy
now, your
dooly.
really high, but that's, I haven't actually spoken to Dr. Coy about that. That's nothing to be concerned about. That just means that like progesterone levels do get really high in early pregnancy, so it's not a concerning factor at all.
Can you tell me the number?
Yeah, it's 191.
Holy crap!
So
you know I had 2 follicles, right?
Like baby on steroids.
Well,
pardon?
You know I had 2 follicles.
Oh, did you? Oh, well.
So
that kind of changes the game, doesn't it?
I was like, well, my tests have been really dark, like ridiculous. And I was like,
okay, well, listen, it very much could be a possibility that there is 2 babies in there.
Yeah.
So with those levels and knowing that now, I didn't even look at your scan because I didn't even really think about that.
No, it was a 20 and a 23 millimetre.
Yeah, you're right.
Yeah.
So, I mean, listen, that could be very much the case. So, and that's the reason why everything is so high.
191. Oh my God! Should I?
Yeah.
I've only just
crazy.
I actually started taking the progesterone suppositories 9 days past, so it's only been a few days. So
that's great. I mean, look, progesterone is, like I said, it's not harmful. It's a good thing. So, I mean, it doesn't really matter too much.
Yeah.
You can continue to do that if you feel that's what you want to do. We can continue to get those bloods done every second day for 2 weeks.
Yes.
Yeah, so that's fine. I'll fax off. Do you want me to just keep faxing them? I can just keep a note in the diary, and then we can just fax them off as we go. Is that okay?
Yeah. No, that's perfect.
All right. Lovely.
Holy dooly, I'm excited.
I know, so congratulations.
Thank you. That's a great number to start with.
Yeah, I know, I was thinking that is super high for how early you are, so that's a really good sign.
Okay. So as you've seen in that clip just then, as I was talking to the specialist, she had said my Hcg levels are 132, and I actually did have my phone near me, but my progesterone was 191, which is incredible. So she was thinking possibly I have twins, and we're pretty excited because we actually knew that we had 2 big good follicles on the left hand side, and that was a possibility. So our progesterone has never ever been that high, and that is without progesterone supplements. I think I'd only just started taking them 2 days prior, so they don't go up that quick. So yes, and so I think the 191 is the Australian, and the US or UK and all that version I think is 60. So, and then 14 days past came along, my HCG was 370 and my progesterone was 208, so it was still climbing. So at this point we are ecstatic that at 14 days past it was 370, they want it to be 100. So 12 days past I think they want it to be 50, and then 14 days past they want it to be 100, and ours was 370. 16 days past it was 724, progesterone was 240. 19 days past my HCG was 1750, and I will put a list of this because a lot of women are interested. Everyone is different, but a lot of women are interested on all the levels, so I'll give you all the levels on the screen in a moment. 21 days past was 3,830. 23 days past was 9,150. 26 days past was 20,900. So we were pretty excited by this point to see those kind of levels. 28 days past was 37,800. That's when I went in. That was my 6-week appointment. I think I went in to see my specialist, and there he's seen a heartbeat. Now I didn't have an internal scan, it was just abdominal, and he did see the heart flickering, which you could see it was like a blur, and he couldn't tell me what the rate was, but we were very, very excited to see a heart rate at that point. So that was, I think, exactly 6 weeks. Then the next day we had a proper internal scan, and the heart rate was 107 beats per minute, and they said anything over 100 they wanted to see, and the baby was measuring 4.2 millimeters, and the yolk sac was measuring 3.1 millimeters. So I was really happy to know that my yolk sac was not huge. So this is how I've known that chromosome issues have been all in my last pregnancies. And please don't be frightened if you do have a large yolk sac. It's not uncommon to have it, but to have a very large yolk sac as I did, and I think they were between kind of 6 and 8 or more. They had chromosome issues, the babies did, and they passed. So it was fantastic to see a 3.1 millimeter yolk sac. So this made me extremely confident that everything was going to be okay. So there was one tiny little bit of relief to see that. So yeah, 30 days passed, which was the next after my ultrasound. My Hcg was 53,500. I could have done the Running Man dance. I was just so excited for that. 35 days passed, was 109,000. My progesterone had come down to 171, but they weren't worried about that at all. I had a scan at 7 weeks and 2 days, and the heart rate was 134 beats per minute. So we were almost jumping for joy then, because we know an increased heart rate, that's a good thing. That's a healthy sign. And then we had another scan, because with my obstetrician, every time I go in, he does a scan. Was 7 weeks and 6 days, and the baby was measuring 8 weeks at that point. And I think I've got another, I'm pretty sure I have an early scan, the internal one that I talked about before. I will add that in here as well. So then 8 weeks. So I wanted to tell you, 8 weeks I got at home, and I bought this probably 2 years ago when I first fell pregnant. I bought a home Doppler, and yes, I know it's sometimes crazy to do that because it can give you more anxiety, but for me it works differently for me. So everyone is different, so there will be some controversy in, you know, should you use a Doppler, shouldn't you use a Doppler. It's not dangerous, it's just that, you know, it's the anxiety it can give if you can't find a heartbeat. So I used a Doppler at 8 weeks. Actually, I tried a couple of days before, but 8 weeks I found the heartbeat just like it was literally for 20 seconds, and I couldn't find it again. And I was pretty excited to hear it on the Doppler, and never have I heard it on the Doppler before. So I tried again the next 2 days, and I couldn't find it, and I wasn't worried about it because I knew that is just ridiculously early to get a heartbeat on the Doppler. Then 8 weeks and 3 days came along, tried again, and there it was. And I will put a clip of my first heartbeat found on a Doppler at 8 weeks and 3 days, recorded, because I hadn't recorded it. I was ready to grab my phone to record it 8 weeks, but I lost it. Not lost my phone, but I lost the heartbeat because it was only for literally 20 seconds. And yes, 8 weeks and 3 days, there the heartbeat is, and here it is.
Oh my God.
See, that was so exciting to hear. That heartbeat was like winning the lotto. And every 2 to 3 days I listen to that heartbeat, and it gives me so much relief. So some people it gives anxiety. For me, it gave me the relief to know that everything was okay still. The heart rate, I think I picked it up, if I have a look on my phone, let me have a look. I picked it up and found it within a minute, so I've actually written this down, and it was strong at 176 beats per minute. So what I did is I put my phone on, and then I record it for 15 seconds, and then I times it by 4, and that's how I got my 176 beats per minute. So I couldn't see it on the screen at that time, so that's why you could only get sound. You could hear it, and I can't give you visual because you can't see how many beats per minute, because it doesn't pick that up. So how I located the heart rate was basically your belly button, go right down to your pubic bone and start just there, and go very, very, very small motions, circular motions, from that, you know, very part of your pubic bone. It's hard to explain. And then just slowly work yourself way up to your belly, not up to your belly button. It won't be at early, like 8 weeks. You're not going to be near your belly button, but work your way up a little bit from the pubic bone. And then if you don't get it in that line of your belly button, try a little bit to the left or a little bit to the right, and you should be able to find it. But just start directly from your belly button, go directly straight down to your pubic bone and try from there. Go on YouTube and have a look at that as well, because there are some ladies that show you visually. Okay, so I had a doctor's appointment, and I did not write how many weeks I was, but baby was measuring on time, good heart rate. We spoke about the scans, my next scan, which is my Nucal Scan, and my Harmony test. So this is a genetic screening, and because I am 42, we're going to have the Harmony test, which costs about $425, I think, in Australia, and that will test for trisomy 18, 20, 1 and 13, I think. So, and there was one other, I can't remember what it is, I'll have to go get the sheet. So yes, we organised those scans, those bloods, and we organised the scans. So I did it around 10.5 weeks, my Harmony, my Harmony test, and then my Nucal Scan was booked for around, I think I was 12 weeks, 6 days. So yes, I went and had my scan. So I'm just looking at my notes here. So I'm just looking at what my I put down every time I've checked the heartbeat, what it was. Now, before I talk about this Harmony test and what my results are there, let me just tell you a little bit about my symptoms. So I basically didn't have many until I hit 7 weeks. And from 7 weeks onwards, oh my goodness, I felt sick from the time I woke up to the time I went to bed, just nauseous. So I didn't vomit, I haven't vomited at all. I've had like a couple little like, I don't even know what it is. So, you know, kind of burp and it comes up and goes back down. But that's it. I haven't had any vomiting, thank goodness. But in a way, sometimes I wish I did, because I have just felt sick. I wake up, I feel sick. I go to bed, I feel sick. I wake up in the middle of the night and I feel sick and I feel starving, and I've got to talk myself into going back to, you know, to sleep, or I've got to grab a chocolate off the side of the bed, my bedside table, because I can't sleep, you know. So I've had to eat constantly little meals, like all the time, to keep it at bay. So no, I haven't lost any weight. I have gained weight because I've had to constantly eat. So there's been no vomiting and no loss of weight. There's just been gaining of weight. So yeah, I went to the different extreme of not vomiting but having nausea all the time. The other thing was extreme fatigue. I tell you, to this day, I am so tired, and I don't sleep though, because I'm too busy with work. But I am extremely tired, and I get home, because it takes me an hour to drive to work, an hour home. So my days are 12 hours and my nights are 16, my night shift. So by the time I get home at 7, and I want to go to bed straight away. And it's very hard when you have a family, because my kids actually are teenagers, but you know, they still want your attention, they still want to talk, and you know me, I just want to go, don't talk to me, I just want to go straight to bed, you know, but you can't do that. So it's been a challenge. Go to work and I'm extremely tired, but I've just had to keep pushing through, and how I've done it, I have no idea. But yeah, if you've ever suffered this extreme fatigue, it's not nice. It's just, and I feel like I'm lazy, and because I go. I like, you know, I will fill my whole day. I'm not a person to sit down, do nothing, sit on the couch, lay in bed, but I want to see nobody, and I wanted to just sit on the couch, and I want to be left alone, and I basically don't want anyone to bother me. And it's not that I don't want them to, I just feel so crappy, and I just don't want to socialise, I don't think. And me feeling really sick and fatigued, hence why, one, I haven't done any videos at all. And it wasn't just that, I've got a computer that has gone crazy, could be operator error, but totally crazy, and I got so frustrated trying to upload and edit that I canned doing any of it the whole time. So I've only just started to breathe and settle down, and that's why I've uploaded the other day. I did it, I felt good. Yeah, so extreme fatigue. What else have I felt? Just breast soreness, I suppose. You know, when I wear crop tops at night time to go to work, and I go take them off in the morning, I feel like I've got to hold my boobs because they hurt so much when I take it off. So yeah, and of course they have grown like a lot. Massive blue veins everywhere. I can't fit into any of my tops, and when I go, and I don't know if you girls can relate, but when I go to a shop to try on dresses, and not maternity stuff, just to try and get a top and pants that'll fit, because you know your waist just starts getting a bit, you actually look fat, not pregnant at this point. Nothing fits the top half, and I just want to put a sheet over me, or you want a Brad shirts, and just wear that all day. So it's been very challenging to try and buy anything. So I haven't bought anything, and it's only just now that I've kind of popped that I could wear something and they go, oh, she's pregnant, you know. So the other thing I did get, so with the other symptoms, which wasn't a lot, I was still taking all my vitamins, and that is, I only just found this, I don't know if you can see it, but I've got this rash that's come up on my chest, and I've realised I've had that in this last week. It actually feels hot there, and it's been feeling itchy, so I don't know what's going on there at all. I was going to mention it to my OBGYN and forgot, because it wasn't itchy at that point. I'd seen it that morning when I went to see him, and everything was fine. I just seen it, and I thought, you know, maybe it was just a rash. And then, yeah, since then, the last few days, it's been itchy, nearly driving me crazy actually. So I don't know what that is. So I might have to go and, I don't know, see a GP, which I don't want to really see a GP, but, or maybe I'll go to the pharmacy and ask them. I don't know what you girls think it is, but yeah, that's very weird. Nothing, I haven't felt sick, I haven't had, touch wood, I haven't had any flu, and a lot of women actually get the flu, and I haven't had any of the flu. What else have I had? And so Monday just gone, I had my appointment, and baby was measuring ahead. Oh, so when I had my Nucal Scan, which I will go to that in a minute, when I had my Nucal Scan, baby was measuring ahead, so always measuring ahead. And I thought I was only 12 weeks, 1 day or 2 days or something like that, and baby measured 12 weeks, 6 days to the technician, but to the doctor who read and did the report, he put 13 weeks. Then I went to my doctor on the Monday after, which was only about 6 days later. Baby measured 14 weeks, so that 14 weeks Monday, and so today I'd be 14 weeks 3 days. So yeah, and my proper scan has dated baby to be due on the 9th of July. It's not the 15th of July like I thought it was. So I've obviously ovulated early, or baby is growing bigger than, you know, it should be. Not should be, but it's great, it's healthy. I know that everything's going well if baby is bigger. I'd rather baby bigger than smaller. So I'll be right back in a second with those Nucal results and Harmony test. Okay, so I have got the Harmony test. The doctor wrote all this down for me because I didn't want to have the sex at the time. I just wanted to put an envelope and you know, we do that later. So he has put down that trisomy 21 was low risk, trisomy 18 low risk, trisomy 13 low risk, and there's a sex chromosome and aneuploidy, which is SCA, and that says a low risk. I expected that to come back at high risk with my age, and I said to Brad, now don't panic, but this test may come back as high risk. I expect that to be high risk, and we expect to do the CVS, the amniotesis test as well. So that the doctor actually rang me on Boxing Day. So he was closed down for Christmas, but he knew, he goes above and beyond, this obstetrician. He's just absolutely amazing. So he knew the anxieties that we were going through, and he rang me with those results. And I tell you, I literally cried and cried and cried, and I wish now, I don't want to record me crying, but I don't think I've ever been so emotional. It was a bit of a shock, I think, more than anything. I was expecting him to say, yes, it's high risk. We already knew that it was going to be, so, you know, let's get the amnio done. He said everything was normal and low risk, and it's actually negative, but they don't like to write negative. It's because it's, anything happens, they're liable. So it all says low risk. Okay, so this is the Nucal Scan. So I had my Nucal Scan, and I will shove some photos of my Nucal Scan in here. Oh baby, so exciting. It was so amazing to see the brain, and they take pictures of both arms, both legs, their stomach, the kidneys, everything. It was their spine, bladder, the whole lot. It was just amazing on what they can see. And baby at that point was only like not even 7 centimeters. Like, wow, how amazing is that? So yes, they put me down, and I'm not sure if you can see this, but at the time I thought I was only like, I don't know, 12 weeks 2 days. Let me see if I can put this down. So they put me down at 13 weeks there, and due date 9th, where's it got there? 9th of July. Yeah, so basically it says the skull brain appears normal, the heart appears normal. Let me just focus this, that's better. Yeah, skull brain appears normal, heart appears normal, spine appears normal, abdomen appears normal, stomach visible, bladder visible, both hands visible, feet visible. Says my cervix 49 millimeters, which I haven't checked that out to see if that's okay. I think it is. And nasal bone present, and there was normal amniotic fluid and 3-cord vessel, saying my placenta is posterior and structure is normal. Now some of the markers, I can't remember all the markers, but the markers for Down syndrome is the nuchal fold, the fluid in the back of the neck. Mine was 2.2, which I was extremely relieved when I seen that. It's never 100%, but they say anything kind of below, anything, I think it's like 3.5 and over, you know, is a concern. So mine was 2.2. Could not believe that that was 2.2. My harmony test came back low risk. I don't know, I've been blessed. I really have. We have. So it actually put, so the comment was a single live intrauterine pregnancy of 13 weeks at that time, and the examination places the patient in a low risk range for all those markers of trisomy and that. So I couldn't be any happier. Like, that is absolutely amazing. It may seem like a weird risk. So the risk here, a lot of women are much higher than mine, but they go off my age. So the scan and how it looked, and having the nasal bone present is part of like the Down syndrome, the bulge at the back, the fluid. So if you have this massive bulge, that can be an indicator of Down syndrome, but not always. So please don't quite, take that as 100%, but that can be an indicator. And I think maybe shorter bones or something like that. I'm not sure. And there's some heart problems that can happen. I'm not sure of it totally. But my age, the risk was 1 in 46, but my adjusted risk after the scan was 1 in 391. So it went up, you know, a lot higher. So, and it's low risk. So I don't even go off that 1 in 391 because at the end of the day it's going off my age. It's the technician or the doctor who wrote the report that said it's low risk. So when I went and seen my doctor about this, he said that not to do the CVS sampling or the amniotesis at all. He said he's extremely happy with the report. Both the reports say low risk. He said it's not worth risking the baby, and what will be, and we're happy with that. So we will go ahead with that, and you know what, if there's a problem, we'll deal with it then. But we've done all the tests and you know they look good so far. So yeah, that is my Nucal Scan, and I will add some footage in here of my Nucal Scan and pictures, of course, still pictures as well, so I'll add that in there. So that almost concludes a very brief 4 to 14 weeks. So if you want to see a more informed video on certain weeks or anything about what's been going on in my pregnancy, just comment below, let me know, and I will do a separate video on certain things. I know that a lot of you have had questions about what we did differently this time to fall pregnant, and you know what worked for us. And what worked for us this time was, and I think I have it, and I don't know if it's 100%, okay, and I can do a better video about this later, but basically the only thing we did differently from everything else that we've been doing was we'd taken this for nearly 3 months, but it's called Ovulation and RPM, and I don't know if, and sorry, I'm just trying to, there we go. Okay, so we took Ovulation and RPM, and we've been taking that for around about nearly 3 months, and it's a combination, I think, of like Western and Chinese medicines. It's from the US, cannot get it in Australia. It was $299 US, and it claims to increase egg quality and raise levels of AMH. So we started taking that for 3 months, and if I didn't fall pregnant, I would have actually done a test to see what how it's affected my body over 3 months, but then I fell pregnant. And it just seems funny that I've taken this and then I have not only like a successful beginning of my pregnancy, but even my scans and my harmony test came back all low risk. So I'm praying that this Ovance, the egg quality, it helped my egg quality. I'm not sure, but I do a mixture of everything else, which I can do in a separate video if you want. Okay, that was one. Acupuncture was another. Keto diet was another. So I did mention the keto diet in another video, and I lost a good amount of weight, and I felt so good on it. It was so hard to do, but I felt really good. And yeah, very hard to do though, guys, very hard. Just to try and meal plan and prep, and and it's hard for you to do keto, and if nobody else does keto in the house, so you have to make it so they like it too. So yeah, definitely keto, definitely the Ovance, and I did acupuncture for sure as different things in that time. So I can do a whole separate video on that. So let me know. What else can I talk about? I'm sure I've missed so much here, and I will make another video with all the other things that I have missed, including the ones that you're going to comment with. I will do a gender reveal in another video. I've got a Ovance, sorry, not Ovance, sorry. It's called, I have got a memory break, see, this is pregnancy brain. Ovusense, aha. Okay, so I bought Ovusense as well. So I will do a video about Ovusense. I'm sure so many of you are keen to know about that. So I have an Ovusense that I bought. I purchased that. I will do a video on I think it's called, nope, it's gone, some sort of box. In Australia it's like a pregnancy box thing, pregnancy and baby box. I'll do like an unboxing of that. I'm sure I've got another one coming along. I've just received one, and I'm sure in another week or something I'll receive another one, so I might do a double unboxing of that. So that's pretty cool. It's got some baby products, all natural stuff for baby and mum. So I'll do that. And what else would I do? There was something else and I've already forgotten to. Yes, and then I don't know, I might stick in a belly shot here. I will do because I haven't got my camera set up properly, I don't have my thing here, I don't want to grab it and move it, but I will shove a still of my 14 weeks and 3-day belly, and then I'll just do them in every 2 weeks. So when I'm 16 weeks I'll do another update, 18 weeks I'll do another update, and I'll do a bump shot, and I'll do what I'm feeling and all the rest of it. And I look forward to a 20-week scan, so that it will be another video on our big 20-week scan. So there is lots to come. That's why I've decided not to go through my videos and upload them all, because there is so much to tell in you know, like I've only just uploaded one video and I've got, you know, almost 15 weeks of information to tell you. So I decided not to upload one at a time. I'll just tell you all in this one video. I'll upload it and then you can tell me what you want to see, and then I'll upload it. So that is all. I want to send all baby dust to those who are TTCing. I wish you a very healthy pregnancy for those who have conceived, and congratulations. We got 20 babies going. It's amazing. I can't wait to see your journey, and I will keep up to date with all the TTCers. I am wishing you all the luck and love. I watch you all on Instagram as well as YouTube. Mostly if you're on both, some are only on one, but that's okay. I want to thank each and every one of you for all the support and the comments you have given me over this last week. It's been absolutely amazing. I am thrilled. We are so excited. You have no idea how excited we are, and we cannot wait to hold our baby soon, like in the next, 24 weeks to go. So we are just super excited. Until then, until my next video, thank you all so much. I love you all so much. Please comment below. Don't forget to like and subscribe, and don't forget to jump over to Instagram, Rainbow Baby Mama 77. Until then, take care. I'll see you later.